Major support for Carolina Business Review provided by Colonial Life, providing benefits to employees to help them protect their family, their finances, and their futures. High Point University, the premier life skills university, focused on preparing students for the world as it is going to be. And Sonoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services with more than 300 operations in 35 countries.
More and more vaccination is becoming a condition of employment, certainly at hospitals, but could that spread to other industries? It's a good question. I'm Chris William, and welcome again to the most widely watched and longest running program on Carolina business, policy, and public affairs, seen each and every week across the Carolinas. Thank you for supporting this dialogue. In a moment, we will start our dialogue around things that are going on now, and later on, Dr. Mary Jo Cagle, CEO at Cone Health from Guilford County in North Carolina. But we start now.
Gratefully acknowledging support by Martin Marietta, a leading provider of natural resource-based building materials, providing the foundation upon which our communities improve and grow. Blue Cross Blue Shield of South Carolina, an independent licensee of the Blue Cross and Blue Shield Association. Visit us at southcarolinablues.com. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. On this edition of Carolina Business Review, Joe Waters of Capita, Sam Konduros from Core Medical, and special guest, Dr. Mary Jo Cagle, CEO of Cone Health.
Well, happy fall and welcome again to our dialogue. Sam, Joe, good to have you both here. This idea about labor and a labor shortage. It was a labor shortage 18 months ago, Sam. Now it may be even, could you call it a crisis? Do you feel like it's a crisis when you try to find talent?
I wouldn't call it a crisis, Chris, but it's a Herculean challenge. COVID has tested every business out there in so many ways. I've described it as life on Mars in some respects. And, you look at especially during shutdown periods and parents trying to maintain vibrant careers while homeschooling children and elder care and things that I know Joe will talk about. It's made it challenging for all of us. The retail sector has been brutalized. But companies like Vicor Scientific, where we're headquartered in Charleston and actually have a role in the COVID pandemic, we've had to ramp up dramatically during this. So we just had to get a lot more aggressive, creative in our approaches to attract talent and to sustain it.
Do you think that's good or bad for economic development? You were an economic developer for years. Is this a good thing or a bad thing?
Many years. Well, it's interesting. It's probably a mixed bag. It's catalyzed great creativity. We're all going to come out of this much smarter and better. And I think the way we approach work is different. I think of employers that are adapting and evolving and getting a lot more comfortable with remote work and folks able to work productively from their homes. It actually creates a lot more options, but it's a dramatic evolution that was forced upon us. And so I think, yes, I see huge opportunities, and particularly in the sector that I'm in. And, healthcare is having to be reinvented in many ways, and life sciences is flourishing.
Joe, economists will call it labor rate participation, and that is, as we just talked about, this phenomenon that there's been an increased amount of people just dropping out of the workforce. First question is, again, same for you. Why, and when would you expect that to go back to, well, normal doesn't really say it, but when would you expect the labor participation rate to go back up, if ever?
Well, Chris, in the last year, we have had double the number of people drop out of the labor force as a result of their caregiving responsibilities. So twice as many people are out of the labor force today.
Just because of that?
September, because of their caregiving responsibilities, elder care, child care. And until we address both of those as a long-term critical infrastructure need for this economy, we're going to continue to see these sorts of labor shortages, particularly for low-wage workers who cannot afford a nanny or someone to come into their house to take care of a loved one. And so when you are thinking about labor shortage, we have to remember that people have responsibilities, particularly caregiving responsibilities, that they're trying to meet, as Sam indicated. while maintaining their careers. And it's very, very difficult if we're not going to treat childcare and elder care as infrastructure that is in need of support.
Don't you get the sense that childcare, at least that cohort, the childcare will become less of an issue because schools are back in session?
Well, it will for those who are in kindergarten and older, but for kids who are younger than that, it's going to become more of an issue because the childcare workforce is also disappearing, right? And we can't forget that whatever's happening in the broader labor market is also happening in the childcare labor market, and it's creating real difficulties for these businesses that are closing, and so shortages of available childcare.
So how do we, Sam, how would you, again, I'm going to ask you to put your economic development hat on here. As Joe just talked about, until we start to address those issues, how do we systemically address those issues of a labor shortage, child care, elder care, et cetera?
It's a tough question. And I mean, especially when you're talking about systemic change. We've all been forced to pivot, adapt, evolve, and I think business at the forefront of that. I mean, I'll give you an example right now. Is I was talking with our CFO yesterday, and we have a couple of employees that we value greatly. They need to move, and for the first time, we're like, we're fine. You can be in another city. You're handling your responsibilities, this and that. So there is an adaptation and choices that business will have to make to respond to some of the challenges that Joe is really highlighting that are very real. But I think we are getting more creative and may come out of this better in the end.
Sam, we talked a lot of it actually, about the idea that you have to pay up for your talent, but that goes to a bigger issue around pricing. Whether it's retail prices, whether it's commercial or residential property, whether it's items at the store, durable goods, foodstuffs, whatever. Hard to ignore these fairly dramatic price increases. Are all of these price increases for talent, for all of these things, are all of these things permanent? Do we have a new high watermark?
I think we're still searching for a new normal at this point that we haven't achieved yet. The real estate bubble is still kind of a phenomenon, and there's a lot of factors playing into these things. For companies like us that are launching a lot of new products and we're sourcing raw materials and components from around the world, global supply chain disruptions continue. COVID continues to exacerbate the supply chain in many ways, in addition to pricing. So it's a complex environment. I think the Delta variant has slowed any normalization that we had hoped for. We're going to football games again, and we're trying to open up, but we still have very tough numbers that we're dealing with on the COVID side. So, Chris, I think we're a ways off from a normal. I do think things are going to settle down ultimately, and become. But it's still going to be a new normal, not where we were before.
Joe, do you think price increases are permanent? You think the cost of living will forever be at this level now?
Well, I'm not an economist, and it's hard for me to answer, but I certainly hope not. And I of course have to think about our low wage people, our low income people across the Carolinas. The struggles that they're experiencing are, of course, real, and I would hope for strong government action at all levels to address those price increases and to ensure sustainability of lives in which people can flourish. Mm-hmm. And certainly the materials, material matters.
Mm-hmm. Yeah, just quickly, we got about a minute left, Joe. Sorry to interrupt you, by the way. I didn't want you to lose that momentum, but just about a minute left before we bring our guest on. In South Carolina, and this is not just true in the Palmetto State, but the idea that this battle royale around masks or not mask continues to rage on. And in South Carolina, the General Assembly, the State House, as it's called, prohibited school boards from mandating masks. And then that was reversed by a higher court. But now it's been reversed again. Where is that, and where will it end up?
Well, it seems like the federal court in South Carolina has blocked the implementation of that, and the state Supreme Court has a different opinion, at least on the proviso that the General Assembly passed relative to school masking. I think the principle that needs to be observed here is not only safety, but also local control. I would like to see school boards being able to make the decisions that are best for their communities.
And the final word on that is both Molly Spearman, Superintendent of Education, South Carolina, as well as Catherine Truitt, who has the same position in North Carolina, agree with you on that. Our special guest is not a stranger to the Carolinas, but new to a job as the Chief Executive Officer. We welcome now Dr. Mary Jo Cagle, CEO at Cone Health. Dr. Cagle, welcome. You look well. You feeling well?
I'm doing very well, Chris, and thank you for having me this morning.
Honored to have you. Thank you, ma'am. You know, it seems the last few weeks, and especially around hospitals, that the idea of being vaccinated is now a condition of employment. Is that the way it will be and is now, and is this going to be permanent?
Well, certainly it is for Cone Health and most of the large health systems in North Carolina. And the federal government has certainly been talking about making that a condition for employment across all of the Carolinas in the United States. And that's not a new idea for health systems. We've had vaccinations for influenza, for hepatitis, for the whooping cough, many infectious diseases that we've required vaccinations for. So it makes sense that with a new infectious disease, such as COVID-19, that we would require vaccinations to protect everyone who works in the health system and, most importantly, protect the communities that we serve.
What does that do for recruiting when the labor market is already tight, and especially at the level that you hire in a lot of the positions? They're skilled plus, and you want the right people and the competitive nature of who and how much you're going to pay. And now the idea that you have to be vaccinated on top of it, some people are going to naturally just say no. Has it exacerbated the situation of trying to find the right talent?
So, you know, one of the things that I do, Chris, is I speak at our new employee orientation every Monday. And for the past 6 weeks, we have had full new employee orientation sessions. So we have been able to fill positions. And yet we know in the Carolinas, there are nursing shortages. Mm-hmm. And that is a nationwide problem. Interestingly, we knew there was going to be a nursing shortage. That was predicted prior to the pandemic hitting. And really, while the pandemic has exacerbated that shortage, that was coming because our population of nurses was aging and our population overall was aging, and we had more patients coming to the hospital, while at the same time our nursing schools were graduating too few nurses to fill the slots. So we knew this was coming. The pandemic has made it worse, and we've got to be very creative about how we're going to address this problem. Mm-hmm. And we're going to have to partner with our schools of nursing, with our legislatures to help us grow the number of graduates. We've got to find support for our nursing schools to help us address this problem.
Sam, question?
Yes, Mary Jo, I'm feeling for you in that I spent the bulk of my last 20 years in healthcare working at what is now Prisma, Greenville Health System, and was already accustomed to the challenges, let's say, you know, on systems, Epic implementation and EMR systems and population health strategies, and, you know, really a lot of challenges. So this pandemic has been brutal on the healthcare world. And when your ICUs are filled up with COVID patients and you're not able to deliver the elective surgeries that a lot of people need and want, talk a little bit about just how you're dealing with that. And in the second wave of Delta, I know these are not times for the faint-hearted in healthcare.
You know, I will say, I have been so inspired by the men and women who work in our health systems and what they have done in serving our communities over the past 18 months. I have seen truly heroic actions. And, you know, I hope it's not a word that people feel is overused, mm-hmm. because I've really been privileged as I've rounded in our hospitals to see what our physicians and nurses, pharmacists, respiratory therapists have done as they've stepped up and truly in a time when our visitation policies have had to be adjusted. I've seen not only have they been the healthcare workers that they have to be, but they've been mother, father, sister, brother, husband, and wife. They have held the hands of those patients. They've given them the emotional and physical support. I've seen them bring in iPads and hold them up so patients could visit with their families and also help them recover. And sadly, when that didn't happen, they've been there to be the support when people transitioned and sadly died. They have been heroic at what they have done and continue to do. I've seen people live out their calling to be physicians, nurses, healthcare providers. They're doing this at really what I would say is a tremendous cost to them physically and mentally. And what we've really tried to do is provide support for them. Early in the pandemic, when so much of school was having to be done virtually, we've tried to support that for them. We're trying to provide mental health support for our frontline workers. And I think we ask the public, that's why we're asking people to be vaccinated and to wear masks, so that we know that makes a difference on who gets COVID and who comes to the hospital. That's the biggest support you can do for our teams right now.
Thank you. Joe?
Thanks, Dr. Cagle. It seems like there will be more pandemics in the future with habitat loss and that sort of thing. The United States would have been at the top of any list in February 2020 for pandemic preparedness. How prepared was Cone Health, and what are you all doing to make sure you're prepared for the next one?
So we had done a fair amount of work with our infectious disease and safety teams, and yet I don't think any of us were prepared for the supply chain issues that hit us. So our team came together like many did and began to do outreach. One of the inspiring things is how we partnered with our community to help us with our immediate supply chain needs. And here in Greensboro, much like upstate South Carolina, we have had textile companies in our blood here, and many of them repurposed some of their work to help us get PPE. Our analytics team quickly went to work partnering with our supply chain and helped us do predictions of how long we could go before we ran out of masks and gowns. And as we worked all of our contacts across the country, we were able to put work into place that allowed us to deal with this and to keep our team members safe. We opened a COVID-only hospital within 30 days. We had just closed a hospital and started a women's hospital. So we were fortunate that we had an empty hospital and within 30 days converted it to a COVID-only hospital. And by doing that, we became quite prepared. So I would say our team did miraculous work to get us prepared to take care of our community.
Dr. Cagle, just the dialogue we're having this morning is evident that the 900-pound gorilla of COVID or any variant on a hospital's short-term and even long-term focus has been about that pandemic. How sustainable is that to continue to be in that urgent care mode? That's the first thing. And the second part of that that's related to that is what is that you need to expand, or there's a hospital system that you'd like to talk about combining with, or any standard strategic decision that healthcare providers have made pre-COVID have gotten now tabled. So when do you see that you're going to get back to normal business? What is normal business, and how does it affect the morale?
Sure. So I would say in the early days of the pandemic, we put many things on hold and really focused on how to take care of COVID. And we're a learning organization. So we quickly began to say, what lessons can we learn? We learned a lot about becoming more agile. We learned more about innovation and partnerships with others in our community. So after that first wave last winter, we began to say, how do we take and operationalize how we're caring for COVID patients and make it part of our daily operations rather than living constantly in crisis mode? And we began to do that. And so many of the things that had been set up, we began to put into everyday actions, and we began to work into our regular strategic planning and our projects. We are opening a new medical center that will open in February, which was a big capital project in place. So we're executing on select projects that we believe will have high impact for our market share and our revenue. Not all of them, but the high impact ones. So when this next wave hit and we had to say, let's make selections on what we're going to continue, we became very focused. We asked our team to focus on COVID and then 3 other high priority areas. So I think the trick to this is you can move forward, but you must be very focused rather than trying to do everything that you might otherwise do.
Yeah, well said. Thank you. Sam, we've got about 4 minutes left. Question?
Yeah, the trends are still challenging. We're a company, Mary Jo, that does a lot of COVID-19 test processing. In fact, during the first wave, we were doing as many as 30,000 tests a day, 48-hour turnaround from 49 states. Delta variant has us back approaching 200,000 tests a month. So clearly, and 98% of the positives are Delta. So it doesn't look like it's going away anytime soon. I look at the long-term impact. How are you dealing, especially, let's say, with patients who need and want elective surgeries, are delaying those in many cases, and also ER response times, which I know has just been really challenging when you have such a deluge of pandemic patients that are many unvaccinated.
So at this point in time, we are not doing any inpatient elective surgery. We are doing our outpatient ambulatory surgery. So there is a hold on a lot of that, Sam. You asked a second question, and I'm sorry I missed that.
It was kind of, I was curious from ER response times, how that's going. I know that's a big challenge.
Yeah, that has been a big challenge. One of the things we've done is work with our communications and marketing department and done that collaboratively with other health systems in the region to talk about alternatives of where our community can go for testing and evaluation for COVID, such as their primary care docs and our urgent cares. So we're trying to give our patients alternatives. We also are really trying to make it easy for them to get virtual care in our community. We have links on our homepage that they can go right to our homepage and link into a virtual care appointment. So providing choices for patients that will get them there. And we have made some progress. I got a report just yesterday that we've been able to shorten that time, and it's still too long. We all acknowledge that that's a big challenge.
We have 2 minutes left, less than 2 minutes left, Dr. Cagle, and you had mentioned early on when you were talking about your nursing staff specifically, the idea of mental health. That, as you well know, working with Health and Human Secretary Dr. Mandy Cohen, that is an issue that is important to her, and I'm sure it's important to you. And it's not fair to say, but we're going to have to shoehorn this into about a minute or less. How do you approach mental health or mental wellness of your staff now that is markedly different than maybe even 12 months ago?
Yeah, so we have partnered with our employee mental wellness and our spiritual care department. We're making rounds on every unit. We're doing unit meetings. And again, we have virtual sessions available to them. So again, using every platform we can to provide access for those teams. We found that some of them are more comfortable in a group setting. So we provide that, especially for the units that are specifically taking care of the COVID-19 patients.
Do you feel like, and I'm sorry, just quickly, do you feel like those employees are subscribing, as you would expect, to this idea of getting help for mental health?
So it's a mixed bag, Chris. Some are very willing to reach out and get it. Others do it in a group with friends. And then there are some who are resistant.
Yeah, sure.
And for those, all we can do is make it available. And sometimes their leader can go and talk to them and encourage them to do it. So it's sometimes those one-on-one conversations, and that's what we have to do.
Dr. Cagle, thank you. Thanks for your leadership at Cone up in Guilford County and across the state and across the region. Best of luck and congratulations on the job. Good to see you.
Thank you, and thanks for having me. I enjoyed it, you guys.
Please come back. Sam, good to see you. Joe, always nice to see you. Happy weekend, happy fall. Until next week, I'm Chris William. Good night.
Major funding for Carolina Business Review provided by High Point University, Martin Marietta, Colonial Life, the Duke Endowment, Sonoco, Blue Cross Blue Shield of South Carolina, and by viewers like you. Thank you.